On a weekday, Kingston will wake up, he will have a shower, he will then have his chicken sausages, and then Daddy will take him to school. When he comes home, we'll sometimes take the kids out, walk up a little bit of Lion's Head, and then come home and go to bed.
Kingston? Kingston?
Kingston was diagnosed with ASD back in 2014. I had a very normal pregnancy. There was definitely nothing which gave any indication there was anything wrong with the child. And when we sent him to preschool, after 3 days, the principal said, there's something wrong with your child. It was the incessant spinning, the lack of eye contact, the non-vocalization of words, not wanting to communicate. When he was younger, it wasn't as bad, but as he got older, he became more and more frustrated, and that led to aggression. He would lash out at tutors every day, hit them, kick them. Most difficult is his lack of self-care, his resistance to anything new, his lack of motivation, disinterest. In terms of medication, that worked for a few months, but not in the medium term. Then the pediatrics specialist wanted to introduce more medication, which we thought we should try not to have more medication on Kingston, which is where we got into stem cells. We had a lot of concerns, as with most parents. What are the side effects? Will this work? What is the worst reaction possible? And is this a proven treatment? Had a lot of questions which were all dealt with comprehensively by the team in Stem Cell Therapy Asia, and that's why we're here in Malaysia to have this treatment.
When Kingston's parents contacted us, we discussed with the doctor in charge, and he has had more than 10 years of administering stem cells, and he came up with the dose that was suitable for Kingston based on his weight, his severity. Stem Cell Therapy Asia is different to other companies in the market because Stem Cell Therapy Asia is the marketing arm of Cytonex. We produce our own cells.
Cytonex is a Malaysian-based biotechnology company. Our cells are manufactured in a clean room, followed by a stringent SOP to check for contamination, potential infectious disease. We also do endotoxin tests. This is actually to ensure that those who are receiving the stem cells are getting a good grade as well as a safe stem cell.
Data suggests that there is active inflammation in the central nervous system of children with autism spectrum disorder. Mesenchymal stem cells is recognized to have immunomodulatory functions, and this can be used to reduce this inflammation. Therefore, it supports and improves the neurodevelopment of the child. And you can see this in cases like in Kingston, where you see that he has better emotional well-being, he's calmer, he's happier.
Stars! Say stars!
Stars.
Yes, all done.
Since having stem cell treatment, he's been more communicative. He listens more to instructions and he complies more with them. Once he came to our room and gave me a hug in the morning. He's never done that before. Whilst he used to lash out at the tutors and hit them every day, he now does so maybe once or twice a month. Within a few weeks of having the treatment as well, he's learned to swim, so he's now water safe. He was jumping in the pool to swim to the edge, which is fantastic. Previously, when we took him to the trampoline park, he would just run out because it was too much. But after the stem cell treatment, he does stay in the trampoline park, the trampoline. And then from the trampolines, he would run to the toilet to do his number one and then go run back to the trampoline, which is great. He's become more confident. He's also open to new experiences, more patient. Kingston has climbed up with us up Lion's Head with a lot of encouragement and pushing him. He's managed to reach the top, and I'm very proud of him for that. Our future interventions is to have more stem cell therapy, and in between then we'll have exosomes for Kingston when he doesn't have the stem cell treatment. There is no miracle cure for autism. It's a question of persisting with whatever treatment which is chosen. It's Persistence, persistence, persistence overcomes resistance. Having seen his progress for the last year, there is positive improvement in the right direction. And then in combination with other treatments, therapies, interventions, we hope to see more progress from Kingston.